U.S. alone, more than 29,740 men are affected by prostate cancer on a yearly basis. The journal article titled Prostate Cancer Risk Factors, Diagnoses, and Management, published on August 9, 2010 by Bruce Turner and Lawrence Drudge Coates. Bruce Turner is a uro-oncology nurse practitioner in London, and Lawrence Drudge Coates is a urologic oncology clinical nurse specialist also in London. I chose this article because my bloodline has a history of cancer, and more so prostate cancer. Prostate cancer is considered genetic, so I'd like to know the risk factors, diagnosis, and management. The author's thesis is to provide an understanding of prostate cancer along with its risk factors, diagnoses, and management. The points of my speech I will be addressing are the risk factors, diagnoses, and management of prostate cancer. One of the main reasons of my speech is risk factors. Risk factors can vary from person to person and are not fully understood even today. One of the risk factors considered is family history. This is important to me because my family has gone through prostate cancer, which is known to be the genetic. Family history is important to nurses because they need to know how to check family histories. A second risk factor is geography. Men who were raised in the Asian continent have the lowest incidence, while African American men have the highest. This is relevant to myself that I know my geographical location and ethnicity. This is important to nurses so that they can know who is more prone to prostate cancer when dealing with and treating patients. A second main point of my speech is diagnosis. The diagnosis can be found from a combination of a variety of methods. One way to diagnose is a prostate biopsy. When taking a biopsy, it is for histological tissue samples and could arguably be one of the best diagnosis tests. This is important to know for patients who might be thought to have prostate cancer, and important to nurses to know for a great way to diagnose. Another way to receive diagnosis is to run a PSA test. PSA tests are solely not a reliable source for diagnoses when run alone, but have given the medical community the privilege of being able to diagnose a minimum of 9 years earlier than pre-PSA testing periods. This is good so that people who might be prone to prostate cancer can catch it early, and nurses can know how to look for early signs. The third point is management and treatment options. There are many different types of treatment to help management of this cancer. However, I would like to point out just a couple. One way to help manage is by surgery. If the patient has a localized version of the cancer, then radical prostatectomy would be a reasonable option. This is good so that the patients can know options and nurses can know effective ways to treat. Another way to treat is by radiotherapy. Radiotherapy is referenced to patients who have advanced localized stages of prostate cancer. Patients should know about radiotherapy and that there are several side effects that can occur. Nurses should also be knowledgeable of the subject to inform patients of what can occur due to radiotherapy. A third treatment option is cryotherapy. This is a new option and is basically just freezing of the cancer. It has very positive short-term effects, while its long-term effects are inconclusive because it's such a new therapy. This article discusses risk factors, diagnoses, and management of prostate cancer, and even furthers the information by going in depth with each of these main points, such as family histories, PSA tests, and surgery. I think that the article did an excellent job of informing the reader of what one might want to know about prostate cancer. They give general information and detailed information. I would certainly recommend this article to anyone who would like to further their knowledge on the subject of prostate cancer.